everybody. Welcome to Season 2 of Exponential Africa Live, a weekly live show that focuses on bringing the best thought leadership, technology, and innovation to the African continent and the world. My late grandfather, affectionately known as Sweet Swinging Smiling Joe, lived to over 100 years old, and he was one of the most positive men I've ever known. He had some great insights and tips into how to keep young, fit, and healthy, and he would always say, always have a colorful plate of veggies and food, and don't overeat. Make sure to breathe in your favorite color and while thinking positive thoughts every morning. Smile when speaking to someone on the phone, they will hear it on the other side, and always exercise. It's a key to staying young and healthy. Zeta Joe attended the SUSE Summit 2019 because he still loved to keep learning and get new knowledge, and he epitomized the concept of lifelong learning. He said that it's amazing to see how these exponential technologies are going to help us be healthier and live longer. He even wanted his own online doctor. Our mission as SingularityU South Africa and Man-Made is to help future-proof Africa by building a global community of change makers who can help solve some of Africa's and the world's greatest challenges. We do this through various educational experiences that educate, inspire, and empower, and by building our community and network. We are delighted that the SingularityU South Africa Summit is going online in 2020, and if you haven't seen it, go out and check on the website. We realize that people still need to come together to learn, unlearn, upgrade, and connect. The SUSE Summit will take place on the 14th and 15th of October. However, you will have full access to the platform for over 4 days from the 13th to the 16th of October to make sure we allow for networking time and deal making. Every week on the show, we're going to be giving away 3 online tickets to the SUSE Summit Online 2020, so make sure to register and stay tuned. The conversation tonight will focus on how we can embrace a digital health future so that we can help Africa leapfrog from sick care to healthcare and help millions of Africans. We need predictive, proactive care focused on keeping Africans well based on their unique values, needs, and circumstances. By utilizing the right tools, technologies, and strategy, healthcare systems can reduce costs, increase operational efficiencies, and improve patient outcomes, all while building a system that benefits consumers and providers alike. On the show tonight, we have Dr. Divya Chander, Chair of Neuroscience at Singularity University, Atlantic Council GeoTech Center. We have Babusi Nyoni, co-founder of Sila Health, a platform that is helping people everywhere access healthcare on any mobile device, and Adam Pantanowitz, SingularityU South Africa faculty, biotech, hacking humans and robotics, investor and inventor. A very special thanks goes out to our sponsor partners, who this would not be possible without: our collaboration partner, the Development Bank of Southern Africa, our global partner, Deloitte, and our strategic partner, MTN. Thanks for your commitment and dedication to making a positive impact in South Africa and Africa. We wanted to say thanks to all the amazing feedback and comments during the show. Last week we heard from Zunaid Mohidin, who has watched all the shows over the last few months and is now working on a robotics school for kids, which is totally inspiring for us. Keep letting us know about these types of things and what you think and feel and how you can make a better impact in South Africa. Lastly, if you want to keep learning about exponential technologies and thought leadership, make sure to like and subscribe to our YouTube page, click the bell to get notified when we go live, and register on the website to get more info and be eligible for the SUSE Summit Ultra Experience ticket giveaways valued at 10,000 Rand each ticket. Let's connect and hear the latest news. First up, an e-health startup straight out of Cape Town has secured a contract with the NHS. South African e-health startup HealthSent, the crowd behind the Synapse messaging platform, has won a contract with the NHS. Healthcare providers use Synapse to confidentially communicate and share clinical updates on patients, enabling real-time responses from practitioners. And in a major breakthrough, scientists have invented artificial skin that can feel pain. Researchers from RMIT University in Melbourne have created an artificial skin that reacts to pain. Their aim is to assist patients who wear prosthetics and to allow for better alternatives to skin grafts and even to augment human skin for the development of realistic humanoids. Another breakthrough out of Cornell University has an army of robots patrolling the human body. And even though the bots are each smaller than the width of a human hair and are equipped with solar cells and 2 pairs of platinum legs, it's still a nightmare to get them to move in a controllable manner. But last month, Cornell Uni researchers tackled this problem, and their microbots are so controlled that they can march. And this master's student is designing to be more inclusive for less able-bodied people, with a device that allows you to control a computer with your tongue. Dorothy Claassen, a master's student of design at the Cologne International School of Design, has come up with an unusual and new way to interface with a computer, a tongue-operated controller. The prototype device is a dental retainer with a ball and magnet attached to it that slides along a set of rails. And here's a story that's out there. Mice have had their genes hacked to bulk up for their space excursion. This might sound like the beginning of the fictional 90s animated series Biker Mice from Mars, but it's actually true and it's current. A team led by Se-Jin Lee of the Jackson Laboratory in Connecticut sent 40 mice to the space station, but some of the mice had superpowers in the form of gene-hacked rib muscles. The findings were incredible. The bodybuilder mice retained most of that additional mass instead of suffering the normal effects of bone loss and muscle atrophy. Their findings are huge for astronauts in the future because it means that they could possibly spend more time on the space mission and less time working out. A large number of Africans battle with the lack of access to essential well-being and clinical consideration. Online health support isn't accessible for a greater part of the region's people, as online health solutions are data-heavy and therefore expensive for the average consumer. Enter Sila Health. Founded in 2019, Sila Health is all about providing personalized healthcare using chat platforms and machine learning and creating comprehensive data sets to advance global healthcare. Answering a need, especially in Africa, they provide a low-data chatbot that gives users answers to their medical inquiries on platforms such as WhatsApp and SMS. Their instant healthcare advice incorporates a natural language processing-based chatbot that gives free instant medical advice. Sila Health is accessible to millions via existing low-data and data-free platforms, FB Chat, WhatsApp, and SMS, and their telemedicine is scalable because their platform enables online doctor-patient consultations via phone in the remotest of areas. Using low data and data-free chat platforms, they are able to reach the unreachable in 14 languages in over 50 countries and have already sent millions of messages across Africa. Time to move into the main part of tonight's show, our digital health future. Let's discuss how we can embrace all these converging technologies so that we can thrive and be healthy in the future. Starting off with, we have Divya Chander. Dr. Divya Chander is a physician, neuroscientist, and futurist who trained at Harvard, UCSF, UCSD, and the Salk Institute. She is the chair of neuroscience and faculty of medicine at Singularity University, visiting scholar in medicine at Stanford, where she was on the Anesthesiology faculty for 8 years, and senior fellow at the Atlantic Council GeoTech Center. During the COVID-19 crisis, she now leads or advises 3 pandemic task forces, including one shared World's Global Pandemic Resilience Task Force, a NASA White House Telehealth Task Force, and a reopened strategy for the state of California. In response to the need for global resilience, she co-founded Plexus, a company building the world's connected immune system. She is also the founder and CEO of Lucidify, a tele-neuro ICU platform backed by AI to map and diagnose brain dysfunction in patients. She wishes someday to see the Earth rise from the surface of the moon. Divya, how are you doing?
I'm doing great. Thank you for having me on.
No, great to have you on.
Pleasure.
Where are you dialing in from?
It's morning here in San Francisco. The skies are normal. They're not orange any longer. So,
Oh wow, that's fantastic to hear. I mean, it's been a bit of a rough time the last few weeks, right?
yeah, I think we have the worst air quality in the entire world at the moment because of the wildfires. So, that's thanks to climate change.
Crazy, sure. And I mean, most people during this pandemic have actually either gone into hibernation or been lost at sea type of thing. And you started three task forces and two companies. Do you want to tell us a bit about that?
Yeah, so some of them I was invited to join, in fairness, but essentially the one that you refer to that was started by a friend of mine who is a NASA astronaut. The idea there was to leverage telehealth, much as telehealth is doing, in order to answer some of the biggest needs within, first, the United States, in terms of integrating both our resources and our sources of data. So where do we have ventilators? Where do we have physicians and nurses? Where do we have spare ICU beds? But also who's tested positive? Where might there be an impending cytokine storm? Who's searching online for symptoms like I've lost my sense of smell? How do we integrate that? And then with the Atlantic Council and One Shared World, we're trying to build pandemic blueprints to be able to reopen the world safely. We don't want to experience a future pandemic like this. This particular virus, although it's been pretty devastating, this is nowhere near as bad as it can get. And with the confluence of, I guess, systemic events, for instance, humans coming into contact with animals more frequently, permafrost melting, which is actually releasing viruses that have been trapped for millions of years, we need better surveillance systems for the planet. And so we're interested in figuring out ways that we can instrument every biome with passive and active sensors in order to prevent future pandemics.
Well, I mean, that's really interesting. I think the One Shared World Summit is actually happening tomorrow, I think. We
Yes.
will be posting about it on our social tomorrow. That's
Oh, thank you
happening.
so much. Yeah, it's right in advance of the UN summit. And we're hoping between the Atlantic Council and One Shared World that we can bring many of these visions to the United Nations and to the G20 so that there may be some sort of global implementation and impetus behind it.
And I mean, people are also talking about the second wave of the pandemic, and we've seen a few countries go back into quite serious lockdowns. What do you think about the second wave,
Yes.
and what are we going to experience over the next 6 months to a year, in your view?
So I'm not even sure it's a second wave in the sense that the first wave seems not to have really truly abated. I think that what's happened is that we did this thing called flattening the curve for a while, and then people got comfortable and they started to relax, and they relaxed social distancing, mask wearing, and all the things that were keeping us safe. Some of it is just being plain tired. Some of it is because people's economies were suffering. But the end result has been to increase the spread of the virus. One of the issues is also that there is asymptomatic spread. So a lot of people who feel that they don't personally feel sick may actually be harboring the virus and spreading it. And so I think we're still actually squarely within this first wave. That doesn't mean that next year we may not see a resurgence, even if we get it under control this year. And I think that probably our best hope is for a safe and well-tested vaccine. And that will enable us to increase the amount of total population immunity. That is assuming that when people take it, and also that the virus doesn't mutate so much like the normal seasonal flu virus, that we will need to keep on updating our vaccines.
No, thanks for that. And I want to actually ask you a couple of more questions on specifically about the pandemic. But let's move on to our next guest and welcome them first. We've got Babusi Nyoni, who is the co-founder of Sila Health. Babusi is a tech entrepreneur working between Amsterdam, Nairobi, and Cape Town. He works in the fields of emerging technology and big data innovation, with a particular focus on developing sustainable solutions for the global south. With over 10 years of experience in the advertising, financial, and technology industries, he specializes in contributing the practical skills needed to drive meaningful innovation in areas where scale and impact are hindered by structural limitations. Babusi is the co-founder of Sila Health, a startup that provides last-mile healthcare across Africa using chat platforms and creates comprehensive data sets to advance healthcare in the region. Sila, thanks for Babusi, thanks for joining us.
Hey, thanks for having me.
So I just wanted to, good on you, man. I just wanted to correct myself in the beginning there because it's Sila Health, not Sila Health, right?
That is correct. It's a Ndebele word which means to get well.
Awesome. Okay, yeah. So it's Sila Health, and I mean, you've already, as we saw in the African Innovation Spotlight, sent millions of messages and helped, tens of thousands of people. Tell us a bit about your story. What was your origin story?
Yeah, sure. So the idea for Sila Health came about when I identified an opportunity for artificial intelligence to fill some of the institutional voids that are created by poor healthcare systems in developing economies. And I started on this idea for close to 10 years. And recently, after realizing there were great strides made in the field of machine learning and particularly in natural language processing, I sat down and created a basic minimum viable product to assess whether or not something like this was needed in the market. And the feedback was incredible. And we sat down in 2019 and looked at what exactly the problem was we were identifying. And we identified that there was a general lack of access to healthcare and medical information in sub-Saharan Africa. And we know that millions of Africans die annually from relatively easily treatable and preventable diseases. And because of the lack of access to reliable information due to the relatively high cost of the internet in the region, which affect app downloads and also accessing that information on platforms such as Google, we noticed that there was a massive opportunity to have an intervention in that particular segment. And we also realized that there was a scarcity of real-time data that is needed in order to contain the spread of preventable diseases. And we noticed that measuring these health trends was expensive and time-intensive, and especially so in remote areas. And in order to contain current and future virus outbreaks, real-time data could very well be the difference between a contained outbreak and a pandemic posing a real threat to all countries in the world, as we've seen recently. We built Sila Health. Just to wrap up, we built Sila Health as a natural language processing chatbot, which gives free instant medical advice on existing platforms that cost very little, if anything at all, to access, such as WhatsApp and SMS and Facebook Messenger. And we also provided translations in 13 African languages, including isiXhosa, isiZulu, Chishona, and Kiswahili. And as you mentioned earlier, we've had over 1 million messages exchanged on the platform within our first year of operations, and we're in over 50 countries, and we're rated between 4.9 and 5 stars out of 5 on average. And it's been a pretty cool journey since then.
I mean, it's just amazing. What's so exciting for me is that that you found this problem, and you're using technology that already exists, and now you're patching on some exponential technology. And it's really it's solving so many people's problems. What is an example of like a request from somebody? What do people actually ask on the platform? What would be like a
So that's really good question. Yeah, so the thing about the platform is it's really shown us this massive behavioral shift in attitudes around access to healthcare in the demographics that we're serving. And that typically the people who we serve would only, go see a doctor if they were certain that if they didn't, they would die. And what they do with more low-level health interactions, such as just asking general questions related to their health, they often defer that to, people in their community who might be able to provide insight. But what we notice on our platform on average is people asking questions related to non-life-threatening conditions, questions around their sexual health, around what it means for certain parts of their body to feel some type of way. It might not be a symptom, it might be just a very general question. And we also have a way to provide a lookup service for specific terminology. So even when we do offer some kind of prognosis and we might use specific terms such as MRIs, we also offer a way for them through natural language to ask for the meaning of specific terms. So we find a lot of low-level interactions happening on the platform. People treat the personification of our machine learning software, her name is Sis Joyce, like a personal friend, and a lot of their queries and questions happen super organically. And it's just been honestly incredible to watch this shift in the culture around accessing healthcare. And I know personally for me, I would only ever see a doctor if my mom knew that if we didn't go within the next 3 months, it would be RIP Babusi. But today, I'm really pleased to be able to bring some kind of an intervention in the communities I grew up in that can help, steer people towards proper access to healthcare without straining the already, pretty stressed relationship between healthcare providers and the people who need health in African communities.
No, thanks so much for that. I mean, people don't realize that you have an online doctor available right now if you go download Sila Health. I'm actually going to download it because we had a medical question last night, me and my wife.
And just to stop, you don't even
I should have written to you.
You can just SMS it, you can just WhatsApp it. You don't even need to download anything.
We should have SMS'd you last night. We will tonight.
Exactly. Yeah.
But thanks so much. We're gonna come back to you in a moment. Let's welcome our third guest, Mr. Adam Pantanowitz. Adam Pantanowitz is a SingularityU South Africa faculty on biotech, hacking humans and robotics, as well as an investor and inventor. Adam is a fanatical technologist who enjoys solving seemingly unsolvable problems, particularly with the help of cloud computing and machine learning. He's part of the SingularityU South Africa faculty with a focus on biotech and speaks about the future of technology with a focus on tech-human convergence. Since studying biomedical and electrical engineering, he has worked in the fields of biotech and software. His innovations have resulted in a number of patents, academic papers, and creations. Some of his other collaborative innovations include a hands-free controlled surgery interaction system, CPR monitoring system, and a computer-based sign language interpreter. Adam is a fellow of the Institute of Engineering and Technology and is chartered internationally as an engineer. He co-founded businesses Aura, Terrific, Labuntu, among others, and acted as CTO of indirect tax fintech business. Adam, how are you doing? Thanks for joining us.
I'm great, thank you, Mick, and thanks so much for inviting me.
Adam, so where are you joining us from today?
From Johannesburg.
Awesome.
I'm at home.
And I wanted to ask you, you've personally, you've in your own personal journey, you've used technology and other methods to overcome adversity. Do you want to just share with us a little bit about your own personal journey with digital health?
Absolutely, Mick, and it's an awesome question because I've gotten into this field of digital health professionally, and I'm very interested in working and tinkering in digital health. I build AI systems relating to digital health, and I use a lot of data to interrogate what's going on underneath really lots and lots of healthcare data. But this was really motivated by a very personal journey in my life. And going back to being about 13 years old, I had a big neuromuscular problem, a condition that resulted in my being unable to walk for a very extended period of time. And I was supposed to never walk again, according to healthcare professionals at the time. This led me on a very interesting journey of exploration because while I was not at school, I was spending all my time in technology on my computer. I was hacking away at software. I was taking my computer apart, and I was just having, a lot of interest and intrigue in the early days of the internet, which gives a little bit about my age away. At that time, I was really just immersed in digital health. In that, I started to understand that over time, I could use technology to take ownership of my own health. And in doing so, that came a little bit later in life where I started to, first of all, track and monitor all sorts of metrics about myself and try to determine what I did, what inputs would cause what specific outputs. I started on this journey to try to really just get all of my information into a repository that I could then observe and make measurements on. And as time went on, the proliferation of devices like, for instance, smartwatches that enabled us to do this at some level of convenience became really an integral part of my life and a big motivator. Various digital health technologies and interventions started to help me change various aspects of my own life. And I'm talking about things from remote mass scale meditation apps, all the way through to tracking measurement data of my resting heart rate while sleeping. So these sorts of measurements then enabled me to really titrate out what behaviors were causing problems for my condition. And by doing that and going through this iterative process of understanding and trying to evaluate my condition, I was then able to find much better healthcare outcomes for myself personally. So I think I've been absolutely greatly enabled by this concept of digital health personally, and have been very fortunate to then engage with it massively in my own career to really just play around and innovate when it comes to putting different technologies together in unique and interesting ways to create different outcomes. So yeah, so it's been a great journey.
How you've actually lived through it, in reality. And I don't know if you watched last night, the Apple Watch just launched again last night, where they've dialed up the healthcare and the doctor online to really look at your heart and really dial that up. It looks quite exciting.
It really
what
does.
are your thoughts on that, on some of these applications of these new platforms like on the watch or the online doctor or the chatbot like what Babusi is doing?
Well, I think it's fascinating, and it's coming into our world at a fascinating time with mass scale adoption. So these devices and sensors that Apple have recently included in their watch are not new. They've just been localized to hospitals and hospital contexts historically, maybe clinical contexts as well, of course, where pre-screening is done or where measurements are made on a patient. But now they're available and delocalized, and they are measuring our bodies all the time. So these miniaturized versions of things like electrocardiogram and pulse oximetry, which measures your oxygen saturation in your blood, are now available on your wrist, and they're measuring all the time. So this changes things dramatically, because no longer do we need to wait for the onset of symptoms in order to know that we need to now seek out healthcare. And as Babusi mentioned, this is obviously something that people only do as a last resort very often. But now we can have predictive information streaming through this exponential growth of Internet of Things devices, which could be sensing our bodies and our minds at all times, right? And be with us at all times. And this would mean prediction. This would mean the ability to know about and take ownership of our healthcare outcomes much more rapidly. This is exciting. This is empowering.
No, thanks. And I think let's join the rest of the panel and follow on from that thought. Divya, what are you thinking about how the pandemic has taught us the importance of treating sickness digitally? It's sort of like catapulted us into this digital world.
Yeah, in the United States, in fact, there's been more innovation in telehealth in the last 6 months than there have been in the last decade in the United States. By the way, some of this was regulatory, right? Because people are always afraid of the things they don't know. So it was very difficult to get, for instance, the US government to enable these things to happen, or even to honestly reimburse healthcare providers for providing telehealth. But as we all know, it's not safe for patients to necessarily come into a hospital setting. And when physicians and nurses can also avoid seeing patients in order to protect themselves, it's probably the best thing. So at the very least, doing triage remotely, which is a lot of what Sila Health is doing, makes everything safer for everyone. It decreases the utilization of total use of resources that are not necessary. But it enables you to also establish a relationship with a healthcare provider whenever you want, whenever you feel that you need it. And one of the things that we have been suffering from even prior to the COVID pandemic is this idea of having sort of this episodic sick care. If you have increased access for people, both in terms of time, temporarily, and also in terms of location, so people who are in remote areas, people will take advantage of the healthcare system more, and they might start engaging, in fact, in preventive care and wellness care. So I think that the proliferation of telehealth is really going to solve a number of problems at once. I think the second piece of it is a lot of what Adam was talking about, which is the integration of edge devices, Internet of Things devices that can continually monitor us and bring this data back into a central place where it can be aggregated so that there can be some sense making. And I want to put in a plug for something that's been very important to me and something I've been thinking about in this global context is how do we both secure and protect that data, but share it also for health insights while protecting civil liberties and human rights so that we don't use these devices as a mechanism to surveil people.
Yeah, I mean, I think it's such a fascinating topic, is that we have to give the data in order to be able to understand what's going on. But then how do you keep it safe and secure and private?
Yes.
Adam, what are your thoughts on that?
Well, I mean, Divya raises such an important critical point, because we've seen the misuse of all of our data in the past, and this is now much more intimate, much more important data that we're talking about. So Divya's point is utterly critical here. I think that we have the technologies to de-identify data appropriately. We have the technologies, and we have had for a long time. Look at cryptocurrency, for instance. That is a great example of where we can de-identify information, and certain people can know it and certain people will not know it. Now, we need the willingness to participate as a society to be able to, as Divya says, have these great healthcare outcomes, because we can share data at scale and have great learnings from that data. But it's so critical to have the willingness to treat it ethically, to engage with de-identifying that data and scaling it. I think it's a crucial point that Divya raises.
And I mean, Babusi, you already were in this industry, and you've seen this rise in this online digitization. You know, what has inspired you on your own journey during this pandemic? How has it helped you, in your own personal journey?
I think not so personal, but still related to the startup. It really changed my perception of the uptake in new technology in a lot of African governments. I'll speak particularly about Zimbabwe. We worked with a few municipalities there to augment their efforts in trying to curtail the spread of the coronavirus. And what we learned was a clear articulation of what the benefits of the tech are. Just immediately accelerated the adoption of natural language processing in a country where you would not accept or expect such a sudden, at least in my opinion, adoption of what is typically termed emerging technology. So it really ignited my faith in the possibilities for tech in solving some of the structural gaps that we have in the provision of a whole lot of services to people in Africa. And I'm pretty optimistic for the road going forward. And just to touch back on the point around privacy and digital health, I think it's such a crucial conversation, and especially for us as pioneers, in at least in some of the communities that we operate in digital health, the onus has really been, on our shoulders to ensure that we don't, tread on the rights of the people who we're trying to provide the service to. And the anonymization of data is something that it's, as Adam said, it's pretty easy to do, and it's honestly just a moral decision that people have to make in order to see if they can still continue with their business model in a way that is ethical, that still allows for provision of healthcare on, interpersonal and also macro levels.
No,
Can I
great.
say something also, Mick?
Yeah, absolutely.
Just to follow on to that, that was very beautifully said. And you brought up one other really interesting thing, and you didn't use the word, but I think it's an important one, which is trust. People will share data, people will aggregate data, people will be willing to allow others to make sense of it for the greater human good if they trust you, right? Even the vaccination, the anti-vaccination movement, it's all about trust. And some of building trust is about our narrative and our storytelling on the ground, building communities, and allowing local leaders actually to pick up and spread this word about what's important about public health and data sharing and how we might partake in therapeutics and the adoption of the technologies you were speaking of. And then just to this idea of securing data, Mick, you mentioned one of the companies I founded, Plexus. We're actually using an entirely new network architecture. So it's a layer that sits on top of the TCP/IP layer of the internet. And every single piece of data, every packet of data is labeled with international standards, and it's actually secured as it's labeled. So there's like a candy wrapper that goes around it. And so the data is secured both at rest and in motion. And it's not like one key. And most people think, well, keys are the way to do this. It's not one key. Every single piece of that data has its own unique key. So you couldn't hack into, say, the AWS cloud or Salesforce and steal everybody's data. You would literally, if you hacked one piece of data, you might get someone's heart rate and now you're done. So there are really new mechanisms, I think, of bringing in distributed data, and blockchain is one possible solution, but there are actually other kinds of decentralized networks, and then other ways to secure it. So sort of leading edge technology that will enable us to actually share data and feel a lot more secure that who we are personally is actually being guarded in a public trust.
Yeah, I think it's one of the most important things of our time is how we actually deal with this trust factor. Adam, did you want to add to that?
Well, I just wanted to pick up on that subtle point about people being willing to share. You know, we've been willing to share data society in a variety of contexts, and we have seen that component of trust being kind of abused at times. But it's so critical that the incentive to share here could mean better health outcomes for a person individually and better health outcomes for all people suffering from a given condition. So there is actually great incentive to share in this example. And so cultivating trust, as Divya says, is just so critical because we're losing out on so much as a result of a lack of trust. We are losing out on potentially great healthcare outcomes for individuals, and just by sharing, one can better one's own healthcare outcomes. So this is an exciting frontier in that should there be systems and networks built like the one Divya is mentioning, it will result in a greater amount of sharing and really incentivize sharing.
No, thanks for that. I think let's move to something. We've got a couple of questions from the audience. We're going to take our first question now from Claiborne Apples, who is asking, beyond these amazing conversations, how do we partner to address exclusion for the disabled community in order to bring them into the mainstream of economic inclusion in the digital age? Let's start with you, Babusi, and then over to Adam.
I think the conversation around inclusion is one that, beyond what it means to tick a couple of boxes, is one that looks at the constantly changing state of what it means to be able and to be human. And in a lot of the things that I've experienced in building this startup, I realized that, if we are building for a human condition that is fluid, we're building a platform that is accessible for all people or all versions of people. And, the participant is completely right in that we cannot achieve any form of progress without being completely inclusive in who it is that we're creating for and who it is that we're, solving for. And there are different ways that we can do it. We try to do it through reducing the cognitive burden for people who are neurologically, I forget the term I meant to append to that, but people of different cognitive skills, we try to make sure that the language that we use is as approachable as possible. And we really take pride in, going beyond what it means to bring a solution to people and really making sure that we make it as simple as possible to comprehend. And also we have loops in place to ensure that when we do communicate and we're not completely understood, we have ways to make sure that we, make those kinds of changes to make the product more inclusive.
No, thanks for that. Adam, over to you. It's fascinating what you're doing in this regard, Babusi. And I think this triggers for me the idea or the thought of the work that we've done at Wits University. I guess a lot of my own personal motivation has been about looking at technology for people who are disabled. There is a great deal of innovation that we can do. In some of our projects, we've created, for instance, an eye-controlled wheelchair that works off of literally an off-the-shelf wheelchair with some control and modification and a simple, cheap sensor that goes across the eye. Now, we used a voltage that occurs across the eye when the eye moves naturally to then drive a wheelchair. This level of accessibility is not just reachable from a digital health perspective as costs massively come down, but also from a physical perspective. And I think it's so critical that we enable disabled people to show up and be present by enabling them with counters to their disability. And this has been a big thrust for me in my work and our work at Wits. It's that we want to achieve the basic interventions and then allow those to scale because they're economically justifiable and economically sound. And so we've been doing a series of these types of frugal innovation projects where we try and build something at very low cost and get it out there, either in a paper or in a prototype, or we build it and we demonstrate it. It actually just comes down to us finding ways in the economy to proliferate those concepts. There is so much work in this space that it is quite astounding. And so I'm very excited for the future of disabled people, the future that can be had.
No, I think that's also a great point that you mentioned. For example, Tilly Lockie, who actually spoke at our summit last year, now that she got her physical arms, those hero arms, it's really helped her immensely, and changed her life completely. So I think it's a huge point. Divya, I mean, can we back up a bit? We just expect that everyone understands what digital health is. Divya, can you just explain in your own words, what are some of the applications out there? What is digital health, and what are the different applications and technologies that make up digital health?
So I am actually not even sure there's one completely unifying definition, but we've been touching on pieces of it. So you're right to maybe go take a step back and try and see if we can integrate this. Maybe one way to conceptualize this is that we live in an analog world, but by taking data within this analog world, whether it's our environment or our own human bodies, and by turning this into something that is sampled, that information can be then packaged nicely and sent somewhere. It can be shared, it can be instrumented, it can be measured. So it's sort of that relationship between the natural world and the data that it comprises that really is all about digital health. What we do with it, whether it's through instrumentation, whether it's through increasing access, which is what Babusi is speaking of, whether it's through measuring signals that can be integrated for the sake of public health, or whether it's by instrumenting the human person in order to augment capabilities, which is what a lot of Adam's work centers around. All of these things are facets of digital health and digital sharing, frankly. And, this brings up some increasingly exponential thoughts. I mean, if we can fully take an analog human and digitize them, whether it's their genetic code or whether it's their neural code, what are those possibilities? Can we create digital twins that we can then study, that we can develop drugs for, that we can have sort of precision medicine approaches for? There's actually a digital astronaut project that's been out there for almost 30 years to understand what the human body will do in space. But could we also make backups of ourselves ultimately and use that kind of coding to replace parts that go bad? People speculate about whether it's possible to back up the neural code and actually create a copy of human consciousness. That I'm not 100% sure if that's quite possible yet, but I think there's infinite possibilities when you take what's natural and begin to digitize it into discrete packets.
I think what you're saying is really is touching on such a great insight, is that we're actually only at the start of this digital health future, because when we start uploading ourselves and our consciousness into the cloud, as you mentioned there, it's going to be a whole new world out there in the metaverse, and as we are enveloped by this digital world. So we're actually at the start of this industry and ecosystem.
If I can add, we truly are, and Mick, the pandemic has actually driven us to more digitization. It's so clear that our adoption of technology, our digital personas have changed, our use of technology has changed. It's all heading in that direction. The pandemic has been, a accelerator for it. It's been a catalyst.
And Babusi, we got a question for you here from Amani Ilungi Nazadi, who's asking, can you use Sila Health for our care project program? Could you use Sila Health for an eye care program?
It would totally depend on the scope. So we would probably be able to manage conditions. I think eye care depends a lot on, like the optics and seeing and a lot of tactile sensors. So it's definitely something that is built to be lo-fi and with that in mind, it's not something that would, be able to prove to be useful in that kind of capacity. But when it comes to, condition management and retention and drug adherence for conditions that might affect one's eyesight, it's definitely the solution for you.
No, thanks for answering that. I hope that answered your question. Just going, something I wanted to ask all of you, let's start with Divya, is what are some of the ways that companies and organizations can embrace digital health solutions? How do they get involved? How do they try and make it safer and better for the employees in the workplace as we go back to, as offices open and we go back to work this year or next year? How do companies and organizations embrace this?
So I think there are two pieces of this. One is very specific to this pandemic. How do we increase safety as we begin to reopen our economies and societies? And for instance, universities are a great example. They're tracking students as they return. They're tracking faculty and staff that are mingling. They're doing it partially through COVID testing and creating anonymized databases, and then issuing advice. You can do things like check vitals around the clock, check temperature, and then provide support and feedback. An interesting thing that's also happening that we haven't spoken as much about is how you might be able to passively monitor different biomes. A great example is wastewater surveillance. So let's say you have a crowded building, a government building, a university, some place where lots of people are gathering, and you need to reopen it. You can actually start, instead of individually testing people, you can continually surveil the wastewater and look for viral RNA sequences. And often you will find it when people are asymptomatic and up to 5 to 6 days before they actually become contagious. And if you begin to sense an increase in the presence of the virus in these environments, then you can go and start individually testing people and identifying people that might need to be quarantined. So essentially, everything you flush down the toilet is telling you something about your own human body. So that's one way in terms of disease prevention and keeping people safe. The other piece of it is for companies to start embracing it for wellness, right? So there's all kinds of connected digital health platforms now. In the US, I'm working with one that is there to prevent diabetes through weight management, lifestyle changes, and things of that nature. And once you start interconnecting people's scales and their Fitbit to monitor their activity and provide them with individualized support, in many cases through things like chatbot.
Oh, sorry, we lost you for a second there. I think Divya has cut out. We'll get her back in a moment. Let's move over to you, Babusi. How do you think companies can engage and embrace this digital health future?
I think as many solutions that work for physical health start to proliferate, the next battleground will be mental health, and I think companies should really take this opportunity to look at augmenting their employee wellness programs with what it actually means to be mentally taken care of. And COVID-19 has brought with it some challenges in terms of what it means to actually burn out and what it means to do the thing that you love, given the fact that we're doing it in different places or at different times now. And I think just going forward, also with the benefit of health tech and decentralized solutions, companies should be able to provide some kind of scaffolding for the employees even beyond this time, in order to ensure that beyond their physical health, they're at least taken care of in terms of how they feel emotionally and mentally.
No, thanks. I mean, I'm going to give you a plug here, is that I think companies can just download the Sila Health app now, and they can start using it right away. Oh, sorry, you don't even have to download it. You can just get it and start using it. It's even easier.
Yeah, so
it's even more frictionless.
So we haven't ventured into mental health as yet, but we're noticing that we have sentiment analysis running on conversations, so we are able to, flag whether or not someone might need some kind of intervention in that sense. But it's something that we definitely have not, skilled upwards and able to provide. But soon they'll be able to download the Sila Health app and get that.
No, thanks. Ed, how do you think companies can embrace digital health?
We have to look at companies as almost citizens of this current world. And the pandemic has brought about a few interesting things as well as observations about health. The first is personal ownership. I think we're all taking much greater personal ownership of our own health. We have a much greater awareness of our health and of others' health. We know this through, just the simple act of mask wearing, where predominantly the knowledge has been that mask wearing protects other people. But this kind of personal ownership and empowerment can be a double-edged sword. And I guess the reason I'm talking about this in the context of companies is that we know that with all this data, companies can start using this data to do things like greater monitoring of employees, making sure that people are showing their giving the neurological attention to a certain context, a certain amount of the day. And I think this actually is counterproductive. It overshoots. And what it does is inevitably breaks that cycle of trust with the company. I think it turns workers into drones. I think it's completely going in the wrong way. So I think the whole important critical message is that companies should be embracing digital health and wellness in all of its forms, be it, as Babusi mentioned, digital health from a fundamental health level and from a mental health level, but critically treating it as an empowerment program to make sure that employees are supported, so that this awareness of health perpetuates into greater health outcomes, a greater ability to engage in our work, a greater ability to be present and to perform, because we are better people, we are healthier people, we are more in control, more empowered. And I suppose the whole aspect of this digital twinning of our health should be used for that upliftment, and certainly not for the monitoring side, which I think is a pitfall. And I think it's going to come back to potentially bite lots of companies who try to roll it out as it becomes more and more available for those companies' employees.
I think that's another great point, is that companies shouldn't get into this police state sort of mindset with monitoring
exactly
the employees.
It's dangerous.
Now, I want to just turn the conversation, just because we are running out of time, a little bit back to the pandemic and the vaccine that you mentioned earlier, Divya. Peter Diamandis, one of the founders of Singularity, is talking a lot about the vaccine, COVAX, and a number of vaccines that are coming out. What are your views on the vaccine? How far away are we from getting one, or are we close? Where are we?
Yeah, despite the claims in Russia, I do think that we're probably very close. There are about 131 vaccines right now that are in clinical trials. People don't realize actually how many there are. They run a spectrum or a gamut, everything from genetic vaccines, which are based on taking the viral sequence and actually turning that into messenger RNA or actual DNA, so that we form an immune response just to pieces of the vaccine that our cells manufacture, to the old-fashioned ways of using inactivated versions of the vaccine. There are all kinds of approaches, and suffice to say, I think that several of them will be succeeding. There are a couple of caveats. One, we do want to make sure that they are safe, not just because of the actual safety, but if they're released too early, and people do end up with severe side effects, we will lose the trust of the public. And once we do have a safe vaccine, we absolutely need the majority of the population to be vaccinated. Otherwise, the possibility of holding this virus at bay isn't going to happen. So we'll need global vaccination campaigns. The second piece of it, which we haven't talked about very much, is our supply chain. So it's not enough to have a vaccine. We need the capacity to make many, many doses, billions of doses of the vaccine. And if supply chain is becoming disrupted, either because of the pandemic or political instability or economic instability, it won't be possible to do this. The third piece of it is, and by the way, there's a lot of trust that has to happen in supply chain. It's its own thing. The third piece of it is democratizing access to the vaccine. During the SARS outbreak in the early 2000s, basically countries that were high income were hoarding vaccine supplies and other therapeutics, and low and middle income countries were sort of being sidelined. And there are new coalitions to try and prevent this from happening, like CEPI, which is the Coalition for Epidemic Preparedness and Innovations. Their goal is to democratize access to vaccines on this planet without care about who can pay for it and who can't. But those three pieces are going to be very, very important.
Now, and then what happens when we get a vaccine? Does that mean that you take it every year? What is it? You take it once? How does that work?
We don't know. Other groups are using artificial intelligence actually to track the mutation, like nextstrain.org. And we have no sense at this point that a vaccine created today will continue to be effective, say, next season if this comes back around, or even 2 months in the future if the virus is rapidly mutating. That actually, Mick, that's a really good segue into the idea that one way we may be able to tackle some of this is a coronavirus, and coronaviruses cause lots and lots of infections. And there are several universal vaccines that are in clinical trials, and those are vaccines that are made against the portions of the viral envelope and spike protein that don't mutate. And if we can get one of those, you can vaccinate against that once. Maybe you'll need 2 or 3 doses, and then you will be immune against an array of coronaviruses. MERS, for instance, was another coronavirus. This is a coronavirus. Those will be incredibly protective.
So interesting. I think we need to have a whole nother episode on vaccines, because it's such a mysterious discussion. You know, you've got polarizing sides on both sides. But thank you so much for that. I think we are running out of time, so I just want to quickly get one last question in from Blessed, who's asking any advice for a budding digital health entrepreneur with ideas but not sure how best to start. Let's start with Adam and then go to Babusi on this one.
Okay, well, as a budding entrepreneur, I think that, this is digital health. I think the boundary, the barrier to accessibility of it is dropping greatly. So you really only need an internet connection and the ability to get some data to get started. You need a computer and you need to be able to try and solve a problem. And there's no doubt to me that we have immense problems. We've all seen this year demonstrated just how proliferant problems are in the healthcare space. And the exciting thing about digital health is that we can all take ownership of our health and participate in the change. And of course, this needs to happen in a safe environment, a safe way, a safe regulatory framework. It's just so unbelievably exciting to think that we can start to really take control of our own healthcare outcomes in our daily lives, in our daily living, and as someone who wants to get involved and solve a problem. So it's so exciting that you're thinking of doing this. And I think you don't necessarily have to be in something like vaccines, immune system training, which is it's like an upgrade for your immune system. You can look at any number of problems that are software oriented, which I think have a much lower barrier to starting, a much lower cost of initiating and starting your venture. So software is to me the way to go when it comes to starting iterating, prototyping, and testing things out with one of the many open databases that relate to health that are available right now.
Thanks. Over to you, Babusi.
Cool. Thank you. And just to build on what Adam said, I think it's super critical for you to solve a problem. But what's more important as an entrepreneur is to solve a problem that people need solved. And I think, Blessed, I just had a quick look up at your profile, and I think you're doing really amazing work at Meditech. And Blessed is actually a fellow Zimbabwean. And I think, I know we're out of time. If you need help helping contextualize your tools and your platforms for, market access and whatever it is that your model is, you can just shoot me a DM. I'm a UX designer by practice, so I'd really be keen to help you break into this field.
No, thanks so much for that. That's incredible, Babusi. I want to end off by just asking each of you, just closing comments. What are some of the amazing things you've seen recently? What are you excited about in digital health? Just as some closing thoughts. Let's start with Adam.
Great, Mick. I've seen some recently, there are a lot of ideas that were 10 years ago just research ideas that are now starting to go mainstream. Divya and I share this interest of the neurological systems, and I just think there are some really interesting interventions in neurological systems which are starting to come online and be better understood. Divya I will defer to Divya on some practical examples if she chooses to share, because she is really at the cutting and bleeding edge of this. And for me, I'm just excited to see a proliferation of access to healthcare prevention and mitigation tools. This proliferation as it goes more mainstream and becomes more democratized. So I'm going to keep my answer very high level and over to my colleagues.
Thanks so much for that. Let's go to Babusi and then to Divya. I want to ask you another question as well.
Yeah, I'm more or less echoing Adam's sentiments as well. I'm really excited at the fact that, healthcare provision is at the forefront of a lot of companies' initiatives. The Apple Watch event yesterday, not to, be too pop culture about it, but it really, it really captures what the focus of a lot of companies are that work in the tech space, and their perception of the importance of healthcare, and also how ubiquitous sensory devices and things of that nature are going to be going forward, and what it's going to mean to actually take care of your own health and be part of a healthcare ecosystem. I'm super excited about that. Neural systems as well. We had the Neuralink demonstration a couple of weeks ago. I'm really excited for the next era of interfacing between humanity and tech and our environment. And I'll just close with that.
No, thanks. I also actually watched that Apple launch last night, and that was amazing. Firstly, to see a leader in tech and in innovation, just with the way they actually put on the event, but also how much focus was on healthcare and on the fitness with the watch, which is just a sign of how important this is to a company like Apple. Divya, I wanted to just go back to that entrepreneur question, because you're also a budding entrepreneur, and I'm sure you've got some great insights to share with the audience. What advice can you give a budding entrepreneur? And then just closing on, what are some of the amazing things that you're excited about coming soon?
So you're right. I'm actually was more of an academic, and now I'm a recovering academic. And so moving from that world into an entrepreneurial world, I would say get help. The best thing I ever did was to extend my network and get advice from people who had successfully done it. So Babusi brought up a good idea. Don't solve a problem that doesn't need solving. You want to make sure you're answering a market need. Don't laugh, Mick, but I actually took a class in how to build a company at the University of California, San Francisco, and I joined an entire ecosystem of entrepreneurs, and I took help from wherever I could get it. And so I have learned a lot. I've learned about cap tables. I've learned about all kinds of crazy things. There's a lot of moving parts, but you can't do everything yourself. So make friends and bring them into your venture. And then about what have I seen recently? I'm seeing that technology that has been used or developed in one space is being appropriated for another. And I'll give you a really good example. Let's go to CRISPR, which is a technology many of the people watching may have heard of as a gene editing technology. Think of CRISPR as a way to, say, search within a genome and look for a certain sort of sequence of base pairs, which typically we think of in disease as being misspelled. And CRISPR has the ability to go in, find those misspellings, and depending on how the enzyme system is tweaked, it can cut them out and actually replace them with the correct spelling. CRISPR, that very first function, the search function, is now being used as a biosensor. So there are a couple of vaccine testing kits that have been developed based on the CRISPR platform. One is through Mammoth Biosciences, which spun out of UC Berkeley. And the other one is Sherlock, and that spun out of the MIT Broad Institute. And what they essentially are doing is searching for fragments of viral RNA sequences by using the CRISPR platform, but they've now been able to take all of those reagents and put them into the form factor of a pregnancy test. So it can be done as a point of care test. It doesn't cost that much for the materials, and you get the result back within 30 minutes to an hour. That is rapid COVID testing. A Swiss group of researchers have now coated nano gold particles with CRISPR biosensors for instance, places like railway stations and hospitals to see if they can detect the presence of the coronavirus. So I think that taking technologies that have been used in some domains and appropriating them for others are actually very exciting.
No, thanks. There's a great African proverb that says, if you want to walk fast, walk alone. If you want to walk far, walk together. So thanks for that point. And I mean, that's super exciting what's happening with CRISPR. I remember when it came out, I think like 3 or 4 years ago, everyone was like, it's this amazing technology. And it's just so nice to see how these applications and how it's developing and the use cases now that is happening. We've run out of time, so I just wanted to say thanks so much to our amazing panel and guests. We are grateful that you are keeping people healthy and safer and well, and keep doing what you're doing. And thank you for sharing your insights on how to create a better digital health future. We're going to be excited to see all of you at the SingularityU South Africa Summit online, coming up on the 14th and 15th of October. And don't go anywhere to our audience. Our giveaways are up next. So tonight we're going to be giving away 3 Ultra Experience tickets to the SingularityU South Africa Summit, valued at 10,000 Rand per ticket, which includes the 4 days of access to the SUSO Summit online platform, as well as unique experiences during the summit. Let's draw our winners. Perrin, please spin the randomizer. And our winners are Morgana Pillay, Maroti Les Taulo, and Lesego Ramokhali. Well done to you guys. You've all won an Ultra Experience ticket to this year's summit. That's all, folks. That's all we have time for this week. Next week, we're having a fantastic episode called Let's Talk About Space, Baby, with some amazing guests, Adriana Marais, SingularityU South Africa faculty, and also going to Mars, Jason Dunn from Made in Space, and Ruvimbo Samanga, who is working on satellite technology. You can go to our website to start registering for Let's Talk About Space, Baby. Put it in your calendar to get informed, and stand a chance to win in the Share the Tech Love giveaway next week for those extra Ultra tickets to the SUSO Summit Online 2020. Thank you all for watching. Make sure to join our social media pages, as well as like and subscribe to our YouTube channel. We've got one last section for tonight where we're going to be giving you some incredible health tech hacks. Please take a look at how these hacks can make a big difference in your life if you're not doing them already. Tech advances are changing the world and leave no field untouched. Here are some digital health hacks worth considering. Tech hack 1. Manage your pain in VR. Virtual reality is relatively new in the healthcare field, but research so far has proved that VR can distract people from their pain. So go get yourself some VR gear and give it a try. VR brands such as Samsung have created healthcare guides and programs which you can download and try out. Tech hack 2, wearable technology. If you're a health-conscious person or have a particular condition, then you should consider wearable technology, such as a smartwatch or a smart wristband. These are beneficial for your health, as they can help you monitor your heart rate and even detect heart disease. Some even guide you through exercises and improving your sleep. Tech hack 3, smartphone health apps. Similar to wearable technology, apps such as Samsung Health and Hawaii Health provide professional guidance and other features to help you keep healthy and monitor your health, offering personalized health tips and solutions. Some of these apps also remind patients to take their medication within the recommended time frame. Tech hack 4, remote medical consultations. Sometimes we stress about the smaller symptoms, overthink, and end up driving all the way to the doctor for nothing. Sometimes we find ourselves so busy that there is no time to stop by the doctor or by a clinic. Virtual 24/7 doctor consultations make things easier for everybody. Discovery's digital health tools, for instance, allow doctors to view your medical record, users, patients to easily connect and consult virtually by video, voice message, or text message. Order medicine online, submit claims, and connect with your doctors through a follow-up virtual consultation. Tech hack 5, voice search. What is the world without our voice assistants? Virtual assistants allow patients to make appointments, book rides to hospitals, and even go through post-medical procedures once released from hospital. They do so by asking questions based on the voice search. They get results. And there you have it. All the tech hacks you need to stay healthy. I hope most of you do these already anyway. Thanks so much to all of you for watching. Join our social media pages as well as like and subscribe to our YouTube channel. I'm McMahon. Let's future-proof Africa together and keep smiling.